Advances in technology have provided physicians with a sophisticated array of diagnostic techniques. Included in this exciting new area of radiology today is the MRI, magnetic resonance imaging. We asked Dr. John Feller of Desert Medical Imaging in Indian Wells about open-MRI.
MRI is an acronym. It stands for magnetic resonance imaging. It's an imaging modality that allows us to use a very, very powerful magnet that's about 15,000 times the strength of the Earth's magnetic field in combination with radio waves and then some antennas that we call coils to take very highly detailed pictures inside your body. And it helps us to decide what things are normal and what things are abnormal in a patient that may be presenting with some kind of a disease or a problem. Your entire body is amenable to having an MRI examination now. The most common examinations are performed on the brain and the spine, but it's also the standard of care for imaging musculoskeletal problems. So if you blow out your knee or sprain your ankle badly and need to be seen by an orthopedic surgeon, that's usually the imaging test that you'll obtain. It's also becoming very complementary for imaging your vascular system. If somebody's looking for a blood vessel that's narrowed in your neck, or they're looking for an aneurysm, which is kind of like a bubble on a tire and a blood vessel inside your brain that could rupture, we can use MRI to look for all these types of vascular disease as well. MRI is not like an X-ray because, first of all, it is non-ionizing radiation. X-ray uses ionizing radiation, and there is some, albeit small, but measurable risk because it is a form of ionizing radiation. With MRI, there's absolutely no risk. Because it's just done with magnetism and radio waves, we've no known complication from this type of a test. So it's the quintessential do no harm way to evaluate you for disease processes. The reason that you don't see MRIs in urgent care centers and most emergency rooms and most general practitioners' offices is it's a very expensive modality. The overhead is very high. These scanners cost on the order of $1.5 to $2 million. And that doesn't even include the siting and the operational expenses that are associated with it. So it's relatively expensive technology, but when it's placed in a center that doctors can refer to from a relatively large area, it can provide care to a large catchment population. So you see them in hospitals and you see them in outpatient imaging centers in general. Desert Medical Imaging is an example of an outpatient imaging center that has MRI on site. We have 3 offices that cover the Coachella Valley, and in each of those offices we have MRI and we also have a multi-detector CT available. In this particular office in Indian Wells we have a PET scanner and ultrasound also available. These 3 offices are connected electronically. We use dedicated T1 lines so that we can transmit the images from each of these MRI units and CAT scanners to the radiologist that's the specialist in the particular area that the exam deals with. For example, I'm usually in the Indian Wells office, but any of the orthopedic MRIs that are done in India or in Palm Springs are also transmitted here, and I read them on a centralized computer system that's called a PACS system. Right now, most of the CT and MRI that's done is anatomic imaging. That means we look at the morphology and the shape of organs to decide if something's abnormal. An example would be a lymph node that enlarges. We know that something's going on. But we're not really looking at the physiology of that. In MRI, there are a number of contrast agents, which are things that we can inject intravenously that are being developed that allow us to do functional imaging, where we actually can look at the physiology and do molecular type imaging, look at cancer cells when it's on the cellular level before it's actually grown into a large mass. So I'd say molecular imaging, faster scanning, and continued improvements in patient comfort. We'll see all 3 of those over the course of the next 5 years.